This week's program was filmed at Medical City, Dallas. Founded in 1974, Medical City is recognized for its state-of-the-art medical facilities and commitment to excellence in patient care. Located in Dallas, Texas, the hospital's medical team consists of more than 1,150 physicians, many of whom are recognized as the world's best in their specialties. Medical City, specialists in life. Welcome to Platforms, the life-lifting news program for women. Now, here's your host, Siobhan Palmer.
Hey, welcome back, everybody, to Platforms, the life-lifting news program for women. My next guest is Dr. Lise Labiche. Dr. Labiche is the medical director of the stroke program here at Medical City, Dallas. For nearly a decade, she's been involved in the advancement of the treatment and prevention of strokes. Dr. Labiche, welcome to the program.
Good morning. It's wonderful to be here.
I'm just delighted. Stroke is the third leading cause of death here in the United States. Huge issue. So what I'd like to talk about with you is what is the unique about the stroke program here at Medical City, Dallas?
Well, first of all, we started just about 2 years ago as a brand new program, and we built from the ground up with really the patient being the focus. Right. Recognizing that we need to treat more patients. The treatment rate for stroke is very low in the United States, and so our emphasis was going to be on recognizing, acutely treating patients, and bringing in every member of the team who's really important to their care.
Now, why is that? Why is the treatment percentage so low in this country?
Well, first of all, stroke patients don't recognize their symptoms and they don't seek medical attention rapidly. They also don't necessarily present to hospitals that are capable of providing the care that they need. Okay. And so it's really very important for us to know how to select patients for treatment because we can really impact their outcome.
Now, you guys here at Medical City, Dallas, you're considered a primary stroke center. I think that's very significant to our audience. Why don't you explain what that means?
Well, a primary stroke center is a center that's capable of providing all of the FDA-approved pharmacologic treatments and secondary stroke preventions, meaning that we have actually been certified by the Joint Commission who have come in and we've been able to prove that we can provide all of these treatments.
Oh, that's true. How many primary stroke centers are there around the United States? Do you have a ballpark figure, or not many?
Well, there's actually several hundred, and here in Texas, we're actually one of the leading states as far as the number of primary stroke centers. Despite that, patients still don't receive acute stroke therapies as timely as they should be. In fact, in Texas, there's a state law that was passed back in 2005 and was implemented in 2009, requiring paramedics to bring patients to certified stroke centers so that every patient with stroke symptoms would have the best opportunity to be treated and improved.
You know, one of the statistics that astounded me on your website, it says that every minute that passes after someone has an incident of a stroke, that can lead to a permanent loss of 1.9 million brain cells. Tell us about that.
That's really significant. Our brain cells, we're born with a certain number and we only go down from there. Brain cells cannot regrow, so that when there's lack of blood flow to a part of the brain, almost 2 million cells are lost per minute, 7.5 miles of fiber connecting the cells. And so it really highlights the need for us to treat people quickly to reverse the lack of blood flow that's occurring.
You know, strokes are the third leading cause of death in this country. Why do you think it's so prevalent in this country?
Well, there's many different risk factors that contribute to stroke, with high blood pressure being the number one. 1 in 3 Americans have high blood pressure, and of those who know about their high blood pressure, only 56% are treated adequately. And so between that, diet, genetics, there's so many things that contribute.
Okay, let's talk about how a patient would be treated here at Medical City, Dallas if they arrive. Let's start the first scenario by ambulance. Obviously, they've had a stroke attack and they've recognized it and they're being rushed to by ambulance. So what happens once they hit the door here?
Well, first of all, we do get a call from the ambulance service letting us know that they're going to be bringing in someone with an acute stroke. And what that does is it alerts our code stroke team. And so they're rapidly triaged. They spend 10 minutes getting labs drawn, EKGs done, a physician assessment, notification of the stroke team, and then are brought back within 10 minutes for a CT scan of the brain. The reason it's very important is that there's a certain number of tests that need to be done prior to giving the clot-busting medication, and so we want all of those done very rapidly.
Okay. Tell us about the CT. What actually happens during that process?
Well, a CT scan is the quickest way for us to look at the brain. It takes only several minutes, and what it does is it tells us whether or not there's been any bleeding into the brain or not. About 15% of strokes are due to actual bleeding into the brain. The other 85% are due to a blood clot, and so that's how we can distinguish very rapidly if there's bleeding or not. We can also give a dye, and and that outlines the blood vessels in the neck and in the brain, so we can actually see if there's a clot present.
Okay. Now, what if a patient walked in suspecting that they might have had a stroke? How are they taken in? Is it essentially the same process if somebody is brought in by ambulance?
It is. The difficulty is we don't have the advanced notification, but we've done extensive training with all of our emergency room staff so that they can rapidly recognize symptoms of a stroke, and then the same process occurs once they hit our door.
Okay. You had alluded to a blood clot earlier. Tell us what the difference between a blood clot and a stroke, or the relationship between the two.
Well, again, 85% of strokes are due to lack of blood flow to the brain, and the most common cause for that is a blood clot that gets stuck within the vessel and blood can't get past it, and so the brain is deprived of oxygen and nutrients, and that's what's known as an ischemic stroke.
Okay. Okay. The whole clotting, what causes a blood clot? I am your quintessential layman here asking all these very basic questions, but it's really interesting.
Well, there's many different factors that go into formation of a blood clot, and one way that it can happen is if the heart is in an irregular rhythm and it's not pumping effectively, called atrial fibrillation. A clot can form in the heart and then it can travel up to the brain. Also, if you've got hardening of the arteries with atherosclerosis, that's an area of damage in the blood vessel, and the body tends to become inflamed and form clot at that site. So again, there's many different ways that a clot can form, but that's sort of the common denominator with ischemic stroke, is a clot occluding a vessel.
Okay. One of the classic symptoms is the speech impairment after one suffers a stroke. Why is the speech impaired during that incident?
Well, the symptoms of stroke really depend upon what part of the brain is affected by the blood clot or by the bleeding. And there's two ways that speech can be affected. One is that the speech can just become slurred, almost as if you've had too much alcohol to drink. And that's because there's weakness of the facial muscles and the muscles in the throat and in the mouth, and so it slurs words. The other thing that can happen is that the comprehensive or the language center can be affected, and in that case you may have difficulty understanding language or expressing what you want to say.
You know, you had mentioned to me earlier about a medication, a blood clot busting medication that's very exciting, and it's really changing people's lives. Tell us about that.
It is. It's called TPA. It stands for tissue plasminogen activator, and it's a very powerful clot busting medication. It's the only FDA approved drug to treat acute ischemic stroke, and what it literally does is it dissolves the clot. It gets into the along the surface of the clot, and it starts to dissolve the scaffolding that the clot is built upon, and so literally it's almost like a liquid Drano for the brain.
So how does the medication, how do you identify where the clot is, and once you do within the body, when you administer this clot busting medication, is it targeted toward the area where you suspect the clot is, or can you just administer it?
Sure. Well, the clot-busting medication is traditionally administered intravenously, so it's just through a peripheral vein, and that's its FDA-approved indication. And in that case, it actually has to travel throughout the body to reach the clot. Now, there are more targeted therapies where a catheter can be placed directly into the artery, threaded up to the site of the clot in the brain, and administer the drug right onto the clot itself.
Dr. Labiche, hold that thought if you would. Ladies and gentlemen, this is Siobhan Palmer with Platforms, a life-lifting news program for women. We'll continue our conversation on strokes with Dr. Lise Labiche here at Medical City Dallas in just a moment.
The Texas Stroke Institute is dedicated to compassionate, multidisciplinary, and quality care for patients who suffer stroke and disorders of the head, neck, brain, and spine. Physicians at TSI offer patients cutting-edge treatment options for neurovascular disorders, including minimally invasive catheter-based therapies for adults and children. TSI encourages academic and research excellence, community awareness, and prevention education. The Texas Stroke Institute is a collaborative initiative that includes 11 North Texas HCA hospitals. The goal of TSI is to develop an effective and resource-efficient plan to reduce the morbidity, mortality, and economic burden of stroke in the region by incorporating medical education and participating in research. Texas Stroke Institute physicians practice multidisciplinary medicine to drive best practice in patient care. Their vision is to become the first system in the North Texas region to offer multi-facility comprehensive stroke care. Texas Stroke Institute, Dallas, and Plano. For more information, visit texasstrokeinstitute.com.